Hey guys, just jumping in here to talk about the whole hip dip thing. I was having a conversation with a client of mine a few days ago, and this is what we were talking about. So I thought I'd share with you what we talked about and my take on it. Do I think that you can change the appearance of your hip dips? Yes, I do think you can. Um, do I think you can completely get rid of them if you have them? Probably not. Everybody has them. They are totally normal, and it is just part of the way that we're built, men and women. It's just that women, it tends to show a little bit more because of the way that women, the structure of their hips and their pelvis. And I don't think men really think about their hip dips a whole lot. They're more worried about like their biceps or their shoulders or their pecs, right? So what do you have to consider when you're talking about hip dips and changing the appearance of your hip dips? I think two things. One is your body composition. The second one is like how those muscles are functioning and growing in that area. So the body composition thing is going to be whether or not you should gain or lose fat to help create more of a smoother contour to the hips. And that's going to determine whether or not you store fat above and below the area, or if you're able to store fat where that dip tends to happen. If you're able to store fat there, then you might want to gain a little bit of body fat. That could help fill out that area. If you're somebody who gains and stores fat above and below, then you might want to have a lower body fat percentage so that again, kind of irons out that area or makes it more of a contoured and uniform shape. You're gonna have to kind of know your body in that sense. And I'm not talking about massive amounts of weight gain or loss. I'm talking about just a few pounds probably of body fat. 3, 5, 10 pounds at the most probably. That's not where I specialize. So I specialize though in the whole muscle side of things. And if I want to look at a pelvis here, the dip area that you're mostly concerned with, that people are mostly concerned with, is going to be like right around here. And what happens is where this bone is, we don't have a lot of tissue between the skin and the bone. So there isn't much there. Even though this looks like it sticks out more, this is where that dip tends to happen because people tend to store body fat above and below this area here, and it's hard to store fat here. So if you are somebody who does store fat here, adding some fat can fill that out. So the other thing that we want to consider though is the musculature over here. So you have a big glute max here that you can train, but a lot of times what happens is people wind up overusing the smaller muscles deeper in here and not really getting this glute max to work as well as it should and develop as well as it should. And so what you have is more tension and tightness in these smaller, deeper muscles, pulling the tissue in and creating more of a dip shape. Lots of like squeezing your butt when you're doing your exercises, a lot of the band stuff where you're pushing your knees out or doing side steps, the external rotation stuff, a lot of that, especially like legs up in the air, kickback, side raises, a lot of that stuff can really tighten some of these smaller muscles and actually create more of a hip dip look. You want to do exercises that challenge your glute max and actually lengthen some of these muscles and open them up so they're functioning in the full range of motion and they're not just sitting there tight and creating that more of a dip shape. So things that are like lunges and squats and deadlifts, those kind of exercises, and you want to be able to make sure that you're doing them in a way that you're not overusing like your back and your knees and your neck, so that your glutes actually have to do the work, so that those glutes and all of those glutes fibers are challenged and developing properly. All right, so you can, in my opinion, change the appearance of the whole hip dip thing, but it takes a bit of strategy. It takes a bit of understanding how your body is and how different exercises can challenge it and affect it. All right, if you have any other questions and you want to get into more specifics behind this, or if any of my programming would maybe help you, then feel free to direct message me, and we'll get on a phone call or something. We'll talk about it. All right, guys. Thank you.